welcome back to XGate Dental. I'm Emmanuelle, and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases. So don't forget to subscribe and follow us to stay up to date, and let's get started. Today, we had a case where we had 3 implants on the upper jaw that weren't connected. We had a bridge with 2 implants and another implant with a single crown. Later on, the patient needed to extract the tooth, and the tooth that you can see that still didn't heal. What you see is the fibrosis tissue on the socket of the tooth. So what we decided to do is not have another implantation, but using those 3 implants, we can have a Pontic in between those 2 implants. We have an anterior with 2 implants and a posterior one, and in the middle we'll have a molar that's Pontic. On the lower jaw, we have 2 regular multi-units on all the implants that needed to make new crowns on top of them. So what we did is, first of all, we removed the bridge. We placed multi-units and we left the area to heal a little bit around the multi-unit with the healing caps on both of the upper and lower jaws. Later on, we took impressions with the scan abutments and intraoral scanner. You can see here that on the upper jaw, we have 3 implants with 3 multi-unit V-types on top of them, 3 scan abutments, and the impressions were taken with the intraoral scanner. On the lower jaw, we have here 2 implants with 2 scan abutments. This is the temporary bridge. We just extracted the tooth. We want to let the gingiva heal a little bit, and we want to have good healing of the gingiva. We want to have some emergence profile of the tooth, and from the gingiva, like having an indentation in the gingiva for the tooth. In this step, it's not the best time to make a permanent restoration. Maybe we'll wait a little bit for the gingiva to heal. Now, because we'll want to change the upper crowns, and because we're changing the upper crowns, we don't want to change the lower crowns also to make them permanent. Right now, we'll leave it temporary, the same as the upper ones, and later on, we'll have a fully healed gingiva. Then we'll change both of the bridges. We'll scan again because we want to know the design, the form of the gingiva, and we'll make both bridges from the start from zirconia or PFM or whatever you want. What we did here today is we extracted the tooth. We had from one side 2 implants and on the other side 1 implant. And instead of making another implant, leaving the bridges, we took out the bridges and we made 1 new bridge that covers the gap that the tooth closed. So now we have, instead of 1 bridge of 2 crowns and a single crown, we have a bridge of 4 crowns on the upper jaw and change the lower also. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more. And of course, don't forget to subscribe, like, and follow. Thank you guys, and see you next time.